My name's Stephanie Tierney. I'm a researcher at the Centre for Evidence-Based Medicine at the University of Oxford. In this brief presentation, I'm going to talk about some research that we've done looking at a particular intervention in primary care called care navigation. A bit of background to this research. We know that people's health and well-being can be affected by a number of factors, including social, economic and environmental factors. And we might refer to these as non-medical issues. So things like social isolation, debt or housing problems. Social prescribing has been introduced as a way of addressing these non-medical issues that can affect people's health and well-being. And social prescribing does this by drawing on assets in the community that can help address people's non-medical needs. Things like groups, organisations, events and charities. Social prescribing can be seen as an umbrella term for a range of activities, including, among other things, cultural and arts events, befriending, gardening groups, exercise clubs, luncheon groups, volunteering and organisations that can offer advice about housing and debt. Our research was looking at a particular aspect of social prescribing, something called care navigators, who link people to assets in the community that can help address their non-medical issues. And they do this ideally by taking time to talk to someone, finding out what matters to them, what are their health and well-being priorities, and then developing with the patient an action plan using assets in the local community to help them address their non-medical issues. We were interested in finding out how is care navigation being implemented in England. So we sent out a freedom of information request to all clinical commissioning groups in England, asking them, is care navigation happening in your area? And if so, what format is that taking? Of the 195 CCGs we contacted, we got responses from 83%, and of those 91% were doing some form of care navigation. However, the format that care navigation took was very varied. It varied in who was delivering care navigation, whether that was someone employed specifically to do that job or an existing member of a practice like a receptionist. It varied in how people got referred, often through GPs, but also there may be self-referral or could be referral through other services like the ambulance service. And also there was variation in who it was for. So some services were for all patients, others were for particular groups like people with long-term conditions or frail older people. And this variation is reflected in the fact that we got 75 different titles from the CCGs who responded for this role of care navigator. We are going to publish the research in the British Journal of General Practice, and if you're interested in finding out more, please contact me at this email address.